Good day, everyone. I am Glyce Meiji, Dolfo of PanDL program from Mussolini University, and today a video presentation will be utilized in tackling this topic as it affords more flexibility to viewers, especially in learning programs. And participants can learn on their time and rewatch presentations when they need to refresh their memory. At the end of these discussions, learners are expected to acquire the following. First is to recognize and apply the concept of communication. Second is to consider communication procedures and information critically. Another is to effectively write for an array of circumstances and populations, to engage in a skillful and ethical approach, also to create and present competent presentations, and lastly, to appreciate how diversity, access, and power affect communication. Now, why is communication important in nursing? Good communication skills are required when working in teams with other nurses and colleagues from different professions. It is also critical to patient centered care. Nurses who take the time to pay attention and to comprehend their patients' concerns are better equipped for tackling issues as they arise, which results in superior outcomes for patients. Nurses are vital in the provision of vital health services and are fundamental in building the health system. They bring people centered care closer together, the communities where it is most needed, thereby improving health outcomes and overall service cost effectiveness. And nurses are typically those who respond for intricate emergency situations and disasters, community defenders and advocates, and communicators and team coordinators. Communication is a key component of health relationships, collaboration, and cooperation, all of which are important characteristics of professional practice. The standard of communication involving nurses and patients has a significant impact on patient outcomes. Now, here are 10 effective communication skills that nurses can apply in the practice of profession. One is verbal communication. Excellent verbal communication is key. Aim to always speak with clarity, accuracy, and honesty. It's also important to know your audience and speak appropriately according to the person's age, culture, and level of health literacy. If you are feeling stressed out or frustrated, be aware of your tone of voice and don't let these emotions leak into your patient interaction. You can encourage patient communication by asking open ended questions such as, "Can you tell me a little bit more about that?" Or avoid using condescending patterns like honey or sweetie and instead use the patient's first name or preferred name. And avoid technical jargon and speak in complete sentences. Second is nonverbal communication. Using elements of nonverbal communication such as facial expressions, eye contact, body language, gestures, posture, and tone of voice is also essential in creating rapport. Simply smiling can go a long way. You can also maintain eye contact and nod your head to demonstrate interest in what the patient is saying. Also, don't stare, but do smile. When possible, take a seat and lean forward to demonstrate your interest. And lastly, use pleasant body language to communicate openness. Third is active listening. Active listening means listening in order to understand the other person's experience. The highest and most effective form of listening requires complete attention and engagement. This skill is important not only for clinical nurses, but also for nurse executives and other healthcare providers as a tool for building trust and commitment with their staff. Active listening includes both verbal and nonverbal communication skills. For example, always nod, but never interrupt. Also, you lean forward and establish eye contact to show that you're interested and include minimal verbal encouragement such as "I understand" and "go on." Fourth is written communication. Written communication skills are also essential for effective nurse to nurse communication. As a nurse, you will be responsible for creating and updating the patient's medical record. And it is critical that the medical record is accurate and current so your patients can receive the best care possible. Also, remember to protect patient confidentiality. Some tips are you have to take notes right after patient care to ensure you don't forget anything. Another is to write legibly and with clarity, utilizing basic language. And third is to take careful note of the dates and times. Fifth is presentation skills. Effective presentation skills are most applicable during handover when you are transferring patient care to another nurse or other healthcare providers. These skills will also help you demonstrate your knowledge and expertise clearly in a variety of workplace settings, such as presenting at conferences, participating in job interviews, giving case reports to physicians, and more. It's a good idea to prepare your speech and practice it. Also, to improve your explanation by including images in your presentation and be mindful of your vocal communication as well as your body language and know your audience and their expectations from your presentation. Sixth is patient education or patient teach back. Nurses are in charge of most of the communication between the healthcare team and patients. This includes informing patients and family members of health conditions, diagnosis, treatment plans, and medication protocols. This skill is especially important for family nurse practitioners who work with patients and families to provide health and education counseling. Patient teach back is an effective communication strategy where providers ask patients to repeat the information back to them. This method improves patient understanding and encourages adherence to care instructions. Poor understanding of information can cause patients and their family members to feel anxious or become defensive. For example, you can say, we went over a lot of information. Now I'd like you to go through it again for me to ensure that you understood everything. Another is you can say, could you please repeat the directions for taking this medicine back to me? And let's go through what we just spoke about. Could you please explain it to me in your own words? Making personal connections. It's important to get to know the person behind the patient. Patient centered relationships are critical in helping patients feel safe and comfortable. Creating meaningful connections with patients can improve outcomes and trust. Some ideas you spend a few additional moments every day getting acquainted with each of your patients. Discover a unique information about each patient and show interest in their lives and share stories of your own. Eight is trust. It's important for healthcare professionals to inspire trust in patients by listening actively and taking every complaint and concern seriously. Building trust takes time. Healthcare settings are scary for some patients. It's important to make them feel as comfortable as possible. Trust is something that nurse educators and leaders should also cultivate as they work to develop the next generation of nurses. To inspire trust, nurse leaders and educators should tell the truth at all times, openly share information, and be open to admitting mistakes. Cultural awareness. You will likely to work with people every day who come from a wide range of social, cultural, and educational backgrounds. Every patient and coworker is unique, And it's important to be aware and sensitive. For example, gauge the patient's fluency with English and grade your vocabulary accordingly, or bring in a translator if necessary and possible. With trans and gender non-binary patients, be sure to use their preferred name and pronoun. Lastly is compassion. Conveying compassion is an essential communication skill in healthcare. According to the Journal of Compassionate Healthcare, studies show that compassion can assist in prompting fast recovery from acute illness, enhancing the management of chronic illness, and relieving anxiety. You can deliver compassionate nursing care by putting yourself in the patient's shoes and understanding their needs and expectations. Thank you so much for listening. For questions, clarifications, or additional inputs, you may type it down in the comment section or you may send an email if you opt to. Thank you and God bless.